Hello and welcome to a brand new episode of Health 360. Well, the week gone by has seen so much conversation around the obsession with anti-aging. Products that are to keep you looking younger, defying age, and even perhaps compromising with your health. Shefali Zariwala's death and the possible link with anti-aging medicines is being analyzed. And this incident has thrown up a whole lot of questions on the industry of anti-aging and what it is doing to all of us. We're exploring that up ahead on the show. I'm Sneha Moldani. You're watching Health 360. Obsession with anti-aging is now fairly common amongst the general population. Regular people are getting Botox done like one gets waxing done. It's actually so common now. But a lot of this has got to do with celebrities normalizing cosmetic procedures. Also Botox, the use of glutathione, fillers and much more. This report delves into how celebrities have popularized anti-aging treatments.
I don't feel the need to justify why I want to look a certain way for myself. Then they said, did you get fillers? Yeah, I did.
In the spotlight of Hollywood and Bollywood, where youth is often equated with relevance, many celebrities have turned to Botox, fillers and anti-aging treatments in a relentless pursuit to preserve their looks. With intense industry pressure and constant public scrutiny, maintaining a flawless youthful appearance has become more than a personal choice. It's often a career necessity. While some stars embrace their enhancements openly, others quietly conform to unrealistic beauty standards, creating a cycle where natural aging feels taboo. From frozen expressions to unnaturally plumped features, the pressure to look forever young overshadows the acceptance of natural aging. The anti-aging fixation among celebrities reflect a deeper anxiety within the entertainment industry, where growing older is often seen as growing irrelevant. From Hollywood to Bollywood, stars are increasingly turning to Botox, fillers, skin tightening treatments, and even biohacking in an effort to defy time. But does this obsession not only distort public perception of beauty, but also raise questions about authenticity, self-worth, and the high cost of perfection in an image-driven world?
And joining me right now is Dr. Desai, Cosmetic and Plastic Surgeon from Mumbai's Desai Hospital. Thank you so much for your time, Dr. Desai. I want to begin by asking you about anti-aging products that celebrities have popularized in a way that even regular people are getting drawn towards it. Anti-aging products and treatments have become just so common among the masses as well, isn't it? What role do celebrities, Dr. Desai, have had to play with normalizing the use of these products?
So anti-aging is a very wide terminology. There are a lot of products which are taken orally, some are taken by IV drips, some are taken topically, and some are also taken by IV infusions and topical applications, right?
Right.
So these common products are mostly vitamins like vitamin C, vitamin A, vitamin D, B12, complex, amino acids. Well, anti-aging industry has been a very large industry globally and also in India from a very, very long time. It's one of the most rapidly growing industries. As you meet people, as day by day, as people are more aware of internet and social media, they want to look good, feel good. So that's why people are gymming more, they're taking care of their body more, they're more healthier, they're eating well, they're eating healthy. And similarly, of course, people use a lot of perfumes, makeups, so many other kind of products. Similarly, they also are looking more to age gracefully or anti-aging or look better, look younger. I would say actually look better rather than looking younger. And of course, take care of certain issues which occur with aging, like wrinkles, like loss of collagen, poor skin texture, loss of moisture, pigmentation which happens with aging, and so many other factors. So yes, it's basically not about celebrities, but generalized awareness which has increased because of social media and internet revolution.
Right. Dr. Viral Desai, I appreciate your time here. Thank you so much for joining in. Well, there also is the world of B-Town celebrities and a dozen plus Hollywood celebrities who vowed never to go in for anti-aging treatments, who promised to age gracefully and embrace aging. Let's tell you more about those celebrities who are doing things a little differently.
In an industry obsessed with youth and perfection, a few stars are rewriting the script, choosing wrinkles over needles, grace over glam, and real over retouched. Here's a look at Indian celebrities who've said no to Botox, surgery, and anti-aging supplements, and yes to aging with authenticity. Recently, actress Malika Sherawat took to social media with a powerful message. In a candid Instagram video, she appeared without makeup or filters, speaking openly about embracing natural beauty.
There is no filter that I'm using. There is no makeup that I've put on. I haven't even brushed my hair yet. This is the first thing I'm doing. I'm sharing this video with you so we all together can say no to Botox, no to artificial cosmetic fillers, and yes to life, yes to a healthy way of living.
Meanwhile, Kareena Kapoor Khan has also chosen transparency over trend. Speaking at celebrity nutritionist Rujuta Divekar's book launch, Kareena said she's against Botox injections. Instead, she believes in self-preservation, natural therapies, and letting age take its course.
Self-belief is everything, however you think, however you feel. It's not about the way I look, it's about the way I feel. And that's what, for me, aging and life is. It's strength training, walking a little, my Surya Namaskars, doing my little work on my own rather than, I'm spending time doing all of this rather than, skin treatments and Botox.
But Kareena and Malika aren't alone. Tabu, still radiant in her 50s, is known for her grace and glow, without ever turning to fillers. Her mantra: yoga, clean living, and self-acceptance. Actor and activist Nandita Das has long rejected both fairness creams and anti-aging pressure. She champions natural beauty on and off the screen. Konkona Sen Sharma, known for her bold performances, wears her age with pride. Her belief: beauty is about truth, not transformation. Veteran actress Ratna Pathak Shah proudly flaunts her silver strands and speaks out against the pressure to look young. In a world of filters and fillers, these women are keeping it real, reminding us that age isn't a flaw, it's a story worth wearing on your skin. Their message: aging isn't something to fight, it's something to own.
A trend where people, particularly young adults and teens, seek cosmetic surgeries to resemble their filtered selfies from social media apps like Snapchat. Does it sound unbelievable? Well, it's true. This is driven by the constant exposure to unrealistic beauty standards, perpetuated by filters that alter facial features, leading to a desire to replicate these digitally enhanced appearances in real life. Yes, Mom. Imagine a situation where a person stops feeling happy about themselves and they're unhappy all the time because of the way they look, because they're so used to seeing themselves in filters, essentially. They've become habituated to see themselves in filters. Well, these filters create a version of you which is not real. Perfect skin, glass-like, big pouty lips, red lips, flushed cheeks, perfect features, light colored eyes. But is that your natural self? That is not your natural self. What happens as a result is that you start hating your natural self.
Some people even consider getting cosmetic surgery to look like their filtered selfies. That, ladies and gentlemen, is Snapchat dysmorphia. A growing issue, especially among young users, and it is truly worrisome, getting even more potent as virtual beauty becomes the new normal. Doctors say they're seeing a surge in young patients asking for procedures not to correct real flaws but to match their filtered photos. Experts warn this could lead to deeper mental health issues like low self-esteem, anxiety, and even depression. The pressure to look perfect online is making people question their natural selves offline. And in a world where face filters are just a swipe away, the real danger is forgetting that authenticity doesn't come with an edit button.
Well, as you scroll endlessly through these curated feeds and perfect filters that make you look like you don't look like, the question to ask right now, is this really a moment where we are losing touch with reality? And Dr. Dipali Bhardwaj, Senior Dermatologist, Elska Clinics and Max Hospital in Delhi's Saket is now joining us. Thank you for connecting. I want to begin by asking you a little about Snapchat dysmorphia. It's so common nowadays and it really can be very serious to many young people. In your opinion, how problematic do you find Snapchat dysmorphia, Dr. Bhardwaj?
Well, Sneha, it's the saddest thing is that that's when I came to know there is something called Snapchat. This is the worst times that we are living in, where the youngsters are so damn influenced by these filters, by these pictures of Bollywood themselves with filters all over Snapchat, Instagram, and they see all these movies and, they are making reels. It's going crazy. How we read in your media all the time where people are dying taking selfies. And trust me, I get a lot of young patients who bring photographs of themselves in filters and they're ready to do anything. They're ready to spend anything to look like that in real, which is impossible. Interestingly, maybe I was a little behind. I did not know that it is their filters. Like few years ago, 5 years ago, patients used to fool us. They used to show us the picture and they used to say, this is themselves only few years ago. And doc, now my blush is gone, my cheek has come down. So as a dermatologist, I used to start taking academic interest and trying to release and give them that kind of a result. But then I realized that they were themselves in filters. So, this is how these youngsters have their mind very, tricky, and they are fooling the doctors also. So we doctors also need to be alert. There are a lot of filters and there are a lot of things with which now I think everybody knows that how AI is operating. But, 5 years ago, it was new. And but I feel the mental psyche of such people really needs to be counseled. It's through your media they should realize that everybody is very pretty. Beauty is one color.
Dr. Sameer Parekh, Chairperson of the Mental Health Program in Fortis Hospital, is now joining us. Thank you, Dr. Parekh. Talk to us about the role that social media, Snapchat filters play in making people so underconfident and unsure about themselves. How does this affect their mental health and cause body image issues?
I think one needs to understand this from the context of how does social pressures influence a young mind, especially when you constantly get feedback that this is the right look, this is the right way to look, this is how you should be. So that should be creates a conformity pressure, and it may affect you in terms of how you look at your own self, your body image, your self-esteem, your self-concepts. And sometimes when you start giving more value to these external vectors, you may start feeling inferior or less about you.
That's really dangerous. I mean, it may not look, dangerous or worrisome at the first glance, but it just perpetuates a mindset that you need to look a certain way, you need to conform to a certain standard, and that is absolutely terrible. Dr. Parekh, thanking you for your inputs, your time here. A strong and important distinction has to be made. Anti-aging medicines by itself are not inherently dangerous. What's risky is its misuse by unqualified practitioners. The problem lies with unlicensed or unregulated providers in anti-aging medicines. When grounded in science, ethics and clinical oversight can be a helpful tool for wellness and longevity. Here's how you can do this right.
From capsules to cosmetic procedures, the anti-aging industry is experiencing a rapid surge. But behind the promise of flawless skin lies serious health risks. As more people turn to supplements, injectables, and off-label treatments in pursuit of youth, medical experts are sounding the alarm. What was once the beauty secrets of celebrities, anti-aging treatments like collagen boosters, glutathione shots, PRP therapy, and hormone supplements is now easily accessible to the general public. These methods claim to slow signs of aging, but when misused, can pose serious dangers. The most pressing concern? Self-medication. Health professionals strongly advise against using such products without proper medical guidance. So what precautions should you take before trying any anti-aging medicines? Always consult a certified dermatologist. Avoid online purchases without prescription. Get blood tests and allergy checks done. Do not mix supplements without doctor's advice. Pregnant or breastfeeding women should avoid medicines, as should those with chronic kidney or heart disease. Even natural-sounding remedies like glutathione or collagen peptides can clash with existing medications, especially for individuals with conditions like diabetes, thyroid disorders, or heart problems. Many assume that natural means safe, but that's a myth. Even vitamins, when overused, can have toxic effects. Aging is a biological process, and while it's tempting to chase youth, one should focus on healthy aging over harmful shortcuts.
Senior hair transplant surgeon Dr. Arika Bansal from Eugenics Clinics is now joining us. Thank you so much, Dr. Bansal. You know, every now and then we hear and we see, news items, and it's absolutely depressing, of just so many people who have undergone hair transplants and it's gone wrong. People have died very recently in Kanpur. As a hair transplant surgeon, what would be your word of advice to people even running to salons really to get these, cosmetic procedures that need to be done, in an operation theatre and not in a salon?
Patient's general health should be screened before the surgery. This is a cosmetic surgery. We can't afford a single morbidity or mortality due to the procedure, because people are doing it for enhancing their look. It's an elective
Absolutely.
procedure. It's not something which is saving their life, or they are in a near dying situation. So we cannot afford to have any kind of miss in that situation.
Well, at least check for the certification is so important, You just can't do it in a regular salon. Talk to us, Dr. Bansal, about what you think of younger people, who've hardly had hair loss and they're wanting to go in for transplants. Is this not body dysmorphia as well?
Body dysmorphia is a little new, and it is increasing day by day, because everybody tends to have a personal Instagram, Facebook account, and everybody is
Yes.
showcasing their life, their complete life activities through that. So an obsession with appearance has increased in the younger generation,
Right.
which has led to an increased incidence of body dysmorphic disorder. But not all cases of young people coming for a hair transplant have body dysmorphic disorder. Some people do genuinely have baldness, which requires surgery only.
All right, Dr. Bansal, I'm going to thank you for joining in, sharing your point of view with us, that some people for medical reasons do go in for hair transplants. But other than that, obsession to look, in a certain way is certainly problematic. And Dr. Ishan Desai, facial plastic surgeon and founder of the Face Center, is now joining us. Thank you so much for your time. I want to begin by asking you, anti-aging medicines are not without side effects. at this point in time, I'd want you really to put the focus on what the potential dangers really are. Patients need to be told about the potential misuse of these medicines as well, isn't it?
You're so right, Sneha, because this anti-aging and aesthetic medicine industry is, it's a booming industry. But there are a lot of supplements which are part of this industry which actually don't have any clinical trials, proper research behind them. And often there is no standardized dosage of how long these medicines should be taken, what are both the short term and the long term risks. And often many of these medicines are available at pharmacies, and sometimes without a prescription people are self medicating themselves and ending up with all kinds of side effects. So we need to be very careful with what we are as doctors prescribing to our patients. At the same time, the patient should also be aware that without a prescription and without proper knowledge, just to chase this kind of youthful face or youthful appearance, you can't compromise your health. I believe in something that supplements should be given when a person is deficient in a particular aspect. So, for example, if you're deficient in iron, you give iron supplements. If you're deficient in vitamin B12 or folic acid, you give supplements for the same. Simply giving supplements for long duration, some like supplements which don't have much research behind them, is a very harmful, practice. I feel it can lead to all kinds of problems. And also, if you give a particular supplement, even the good ones, like for example, let's say you give an iron supplement or a vitamin D supplement, it should be taken for the time limit that has been prescribed by the doctor. If it's a 6-week course, then you take it for 6 weeks. You don't indefinitely take it, because there's always a risk of, too much. Too much of a supplement can lead to toxicity.
All right, it's very important, and also doctors, their role also becomes important in telling the patient what the possible side effects could be. Dr. Desai, I'm going to thank you for your time here. Appreciate your joining us with those very important inputs and that light that you throw on the fact that supplements can't be forever. You need to go back to your doctor and check if they should be continuing with those medications or not.
Absolutely. Thank you so much.
Thank you. And India is moving steadily toward ensuring universal health coverage for all its citizens. But in that journey, one crucial area often goes unnoticed: eye care. People regularly get checkups for conditions like diabetes or heart health. But when it comes to their eyes, care is often delayed until the problem becomes serious. And by then, treatment is harder, sometimes irreversible. One growing concern is the rise of myopia, especially in children, due to increased screen time and reduced outdoor activity. According to an AIIMS study, cases of childhood myopia have tripled in the last 10 to 15 years. In urban India, 1 in every 4 children now wear glasses. To talk about these growing challenges and the solutions available, we are joined by Dr. Ashwin Agarwal, Chief Clinical Officer at Dr. Agarwal's Eye Hospital. Thank you so much for your time here, sir. I want to begin by asking you, the rise in myopia among children and increase in eye-related issues, especially in urban areas, has become a growing concern, especially in urban India. Could you help us understand what's driving this trend and how parents can take early steps to prevent or manage it?
Excellent question, Sneha, and thank you for having me. So I'll tell you first the incidence of myopia. 1999, we had 4% of India that was myopic. 2019, we had 21% that was myopic. In 2025, we have about 24-25% myopic. By 2030, we're going to reach 30%. By 2040, we're going to reach 40% and close to 48% in 2050. So that's a jump of myopia at exponential levels. There are two options we have. One is prevention, one is cure. Prevention is, there are new technologies that are now coming in, Ortho-K and others, which are going to help us in the future to prevent myopia in the kids that have not yet got myopia. Treatment options are SMILE, LASIK and other refractive surgeries that can help us in treating myopia in patients who have already got myopia. Now people think of this as a cosmetic procedure. It's not, because myopic patients are wearing glasses that is like crutches to the eyes. They cannot do anything without those glasses. It's basically they're dependent on the glasses. What we're doing with refractive surgery is removing glasses for life. This are the two basic ways that we can address this issue of myopia over the period of 2025 to 2050.
You know, Dr. Agarwal, could you share some key preventive checks and measures people should be following to maintain good eye health? Eye care, of course, we know has evolved significantly over the years in terms of technology and diagnosis, and the information you share will, of course, be very important.
Fantastic. Thank you so much. Here, I would directly like to highlight, Sneha, that we actually want to, anybody above the age of 40, there are three conditions that I really want to highlight: cataract, glaucoma, and diabetic retinopathy. These are three conditions that can be quite significant and quite debilitating when it comes to vision. Cataract, we all know, is an age-related condition where the lens goes cloudy. Glaucoma and diabetic retinopathy are chronic conditions. Glaucoma is also known to be a silent killer because all symptoms are missing in the beginning and it suddenly shows up at the end with a tubular vision only. The peripheral vision is completely lost. So the one way that I would definitely recommend in all of these three conditions is to have an annual checkup above the age of 40. Between the ages of 20 to 40, at least every 2 years, one eye checkup to be done. This would really help the ophthalmologist community to diagnose with all the sophisticated latest equipment that is, and also to treat early. If we catch this early, we're able to intervene and stop this from progressing. This is my humble request to all viewers.
So with so many Indians living with chronic conditions like diabetes, how important is regular eye screening? And what role does lifestyle really play in conditions like diabetic retinopathy or for cataract?
Fantastic. Thank you so much for this question. In diabetic retinopathy, lifestyle plays a huge role. From the food we eat, from the stress levels that we manage, from the exposure that we have towards awareness and healthcare or wellness regime, from our workout regime to our diet, what we're doing, everything counts when it comes to diabetic retinopathy. And it's not something that can be just ascertained to a particular phase of 1 year or 2 years. It's a chronic condition and it happens over a period of time. 10 to 15 years it takes for diabetes to impact the vision or eye. In terms of cataract, it's a pure and simple age-related condition, but yes, exposure to sunlight has a direct impact. So I see a lot of patients who are young and exposed to sunlight. For example, a police cop standing in the traffic light for a long time, at the age of 38 or 37 comes to me with cataract, versus a sedentary lifestyle person who sitting in the back of a desk would come to me only at 45, 50. So this is the difference between how cataract impacts and how exposure impacts this. What I would definitely recommend, like I did in the previous one, was an annual checkup after the age of 40 is a must. Sometimes if you have cataract, if you have the glaucoma or diabetic retinopathy, go twice a year for a checkup. This is my recommendation.
Dr. Agarwal, how much has increased digital exposure contributed to rising eye problems today? And what would your advice be to our viewers, especially the younger generation, on how they can keep a check and make responsible choices for better eye health?
Okay, this is excellent, and I probably will give some 2 or 3 really good tips. If they follow it religiously, it would help them in the long run. One is a 20-20-20 rule. It's a very simple rule actually. It's difficult to do or easier said than done. But basically the aspect is for every 20 minutes, 20 feet away for 20 seconds, just look. Don't look at the monitor, don't look at the screen. Just look away. Every 20 minutes, when you're working on your laptop or you're seeing mindless scrolling, you're doing any of that, for every 20 minutes, 20 feet away for 20 seconds. This is one aspect. The second aspect I would definitely say is to cup your hands, just cup your hands and close your eyes when you are working on long hours. IT professionals do this for 10, 12 hours straight, knocking down a lot of computer work. And this can be very straining to the eyes because you will definitely end up with dryness over a period of time. That dryness can be avoided rather than treated. This is where the cupping rule really helps. in avoiding that. And the third aspect which I would definitely recommend is to be conscious about the amount of time that you're spending on these devices. Try and do outdoor activities if you're younger. And I obviously, as being a professional ourselves, we know the importance of devices. We know what's happening with the AI world. So try and find a balance between this is what I would recommend to everybody who's viewing this from a digital eye strain perspective.
Well, thank you so much for these valuable insights into eye care, Dr. Agarwal. I'm sure our viewers will benefit immensely from this conversation and will hopefully be encouraged to prioritize their eye health with regular checkups and balanced lifestyle choices.
Thanks a lot, Sneha. Thanks a lot for having me. Bye.
Well, that brings us to the end of this edition of Health 360. We hope you enjoyed watching the show as much as we did, putting it together for you. You can catch all of these reports and much more up on our website, that's indiatoday.in, Twitter, which is X, Instagram, Facebook, YouTube, and also Facebook. Our reports are carried there as well. Our hashtag is Health360, Health360 Plus. Do not forget to like, subscribe, and share. Thank you so much for watching. Take very good care of yourself. Be safe. Bye for now.